Hello, my name is John Thurlow. I'm a physiotherapist working for Somerset NHS Foundation Trust. And I'm going to talk about osteoarthritis of the knee. I'd like to explain about the condition, the symptoms you might experience, as well as giving you some ideas on how to manage these. I will also talk about what exercises might be helpful to keep your knee strong and enable you to do the activities that are important to you. If you want to skip any of these subjects, there are links in the comments below that will take you to the part of the video that you are looking for. This is a picture of a knee joint. This is the thigh bone, the femur, and the shin bone, the tibia. In between these two bones you can see the meniscus, otherwise known as shock absorbers, of the knee. You may also have heard of them referred to as cartilage. There is a smooth layer of thin cartilage over the bone ends and strong ligaments that support the stability of the knee both inside the joint, the cruciate ligaments, and either side of the joint, the collateral ligaments. This is the kneecap or patella. It sits in the groove of the front of the knee and slides up and down when you bend or straighten your knee. The knee joint and other structures are covered by a capsule or sleeve that contains natural joint fluid to help with lubrication. And then we have the muscles that control the knee's movement on top of all of this. Osteoarthritis is a normal process of aging in a joint, just like we might see grey hair and wrinkles. The knee is the most commonly affected site, as it's a joint that deals with a lot of weight bearing and impact. The main symptoms that people complain about with osteoarthritis are pain and stiffness. Some people also notice swelling, redness, and heat. People often tell us their symptoms come and go, and that they have good and bad days. We also hear people say that their knee is very stiff and sore first thing in the morning, and that it's difficult to get going once they've been sitting for a while. In more advanced knee osteoarthritis, the stiffness can last a lot of the day. Sometimes people mention about getting a sudden increase in their symptoms for no apparent reason, and we call these flares. At the time of a flare, the knee becomes more painful and may swell and become red, and activity might be more challenging. In some cases, sleep can even be disturbed. They are a normal part of having osteoarthritis. They can sometimes last up to 4 months, but will settle back down again and will be more manageable after this. We know that these flares don't correspond with any structural worsening of the joint, so you shouldn't be afraid to use your knee even when it feels somewhat sore. You may also have heard the term Baker's cyst when talking about knee arthritis. A Baker's cyst is a common symptom of arthritis of the knee. It happens when the capsule of the knee creates a type of release valve for the increase in fluid inside the knee. This fluid is then released, pushed into a pocket at the back of the knee, and it will look like a lump, something like this. Again, it's nothing to worry about. The best way to start managing knee osteoarthritis is by keeping active. This should involve some aerobic activities, like walking, cycling, or swimming, as well as some strengthening and flexibility exercises. We'll go into more detail on these in the next section. Sometimes people say they worry about masking their symptoms, but there's no clear evidence that this is the case. In fact, being in less pain may make it easier for you to do some of these activities and help you work on your muscle control and joint function. Ice and heat can also be really useful ideas to help you with your knee pain.
When it comes to pain relief, there is a ladder that we can think about when choosing what to try, shown in this picture. The advice from the National Institute of Clinical Excellence is to use pain relief at the lowest effective dose for the shortest possible time. It makes sense to try the least strong medication first and work your way upwards if those aren't helping. The first thing you can try is an ibuprofen gel, which you can buy from a pharmacist in strengths of up to 10%. If that hasn't provided adequate relief, a short course of oral anti-inflammatories can be tried. These can be over-the-counter, ibuprofen, or a stronger prescribed medication if needed. These are useful when you're having a flare, or if you have a worse part of your day, but are not a good solution to take all day, every day, because of the possible harmful effects to various organs with prolonged use. Anti-inflammatories can interact with other medications and certain conditions, so we recommend you discuss first with a pharmacist before taking them, if you aren't sure. It's also important that you don't take a full dose of anti-inflammatory if you're using the gel as well. The next medication you can try is paracetamol, which you can take with an anti-inflammatory. Paracetamol works best at the full recommended dose. Within the recommended dose, it's known to be very safe and effective, without significant side effects. If these approaches have not helped you enough, the next step up is to try a mild opiate medication. You can try an over-the-counter cocodamol as a starting point, or contact your GP to discuss further if you need. These medications are only for short-term use. They can be helpful for a flare, but are not suitable for prolonged use as they can become less effective and can also be addictive.
It's important to note that pain and swelling in the knee may stop the muscles from working at their best. People often talk about having a high pain threshold or not wanting to take too many pills. But it's important to be proactive about managing pain and swelling, because these are factors that drive the condition. Icing for 10 minutes and elevating the knee when it's swollen is an easy thing to do and can improve the muscle control in the area. It's worth doing. Maintaining a healthy weight is also really important for people with this condition. The knee takes the force of 2 to 3 times your body weight when it's going up and down stairs. And this is a load-bearing problem, so the bigger the load, the bigger the problem. Losing weight makes a huge difference to how symptomatic your knee will be. However, it's often hard to manage weight, especially when activity feels painful. There are a number of local services available that we can signpost you to help you with this, or you can discuss this further with your GP. Another option to help you manage your arthritis is using a walking aid, such as sticks or poles. These can help offload the stresses through the knee and help you stay more active. Good supportive shoes also help absorb some of the shock coming through the knee when walking or running. Some people also find that using a knee support or brace makes them feel more comfortable during activity. When you are struggling with these management options or having trouble sleeping because of pain or swelling, we may discuss the idea of a corticosteroid injection as the next step. These are designed to reduce the symptoms of osteoarthritis, pain and swelling. They do not improve the condition of the joint in any other way, so keeping up with all the other options we have discussed to manage arthritis in your knee is important. Recent evidence has also shown that this can speed up the progression of osteoarthritis in some people. So it's something to have a careful discussion with your GP or physio about. We can repeat corticosteroid injections into the knee, but the evidence suggests that it's only safe to do so 4 months apart with a maximum of 3 per year. We tend to find more often we do them, the less effective they tend to be. The last step in our options to manage knee joint arthritis would be to consider forms of surgery, but through regular exercise and simple lifestyle changes, this is by no means inevitable for anyone who is diagnosed with osteoarthritis of the knee. As mentioned, exercise, staying strong and flexible is the best way to look after a knee with osteoarthritis. The muscles around the knee add stability to the joint, so keeping these in good condition will protect your knee. Regular movement helps the joint keep lubricated and stops it from becoming too painful. Some activities are more irritable than others, so it's worth exploring the options and choosing sensibly. Perhaps you can choose some activities for your good weeks and save gentler, low-impact activities for flares. There are so many different options available for you, such as cycling, swimming, dancing, gym work, exercise classes. It doesn't matter what you do as long as you are consistent. It's recommended that you should try to build up to 150 minutes of moderate exercise each week and strengthen exercises at least twice a week. So really finding something that you enjoy is the best recipe for success.
Heel slides. We know that part of the arthritic process involves a loss of range at the joint, so every day it is worth taking your knee to the end of its ranges. Sit on a flat surface and slide your heel to the bottom as far as it will go, then straighten it out as far as it will go. Repeat a few times. If you find it uncomfortable to sit with your legs straight, you can bend and straighten your knee whilst sitting in a chair. Straight leg raise. Lying down, press the back of your knee down to tighten the muscles above your knee, then lift the leg straight about 10 inches from the surface. To make it harder, you can hold the leg up for longer. Knee extension. Sitting on a chair, squeeze the muscles above your knee to straighten your leg. Take time to control the lowering phase. You can make this exercise harder using a resistance band, which your physio can provide, or you can buy some ankle weights. To make these exercises effective, you need to tire the muscle out well, so use a weight that you can't do more than 8 good repetitions with. Bridging. Lie on your back. At the start of the movement, flatten the back and tuck the tailbone under. Breathe out and squeeze your bottom to lift your pelvis up. Breathe in and gently lower. You can make this exercise harder by holding for longer or by using one leg at a time. Sit to stand. Starting from a sitting position, drive your weight forwards and push through the heels to standing. As a progression, standing up straight, bend your knees and push your bottom backwards as though you are going to sit on a chair. Squeeze your bottom and stand up. You can make this harder by holding a weight at your chest or in each hand.
We hope you found this helpful. Your GP or physio can help you with any further advice or guidance. And we also recommend the NHS website and the Versus Arthritis website.